Dr. Vicki Peterson. I'm founder of Health Now Medical Center and co-author of the book, The Gluten Effect. Today's question comes from a mom and grandmom who has celiac disease. Her children, she says, are not interested in finding out whether they have a problem, but she's concerned about her grandchildren and is wondering if there's any merit or any time frame when gluten should be introduced versus held off for the health of the child. So in our book we discuss this. There is a great study that was done on over 1,500 children and evaluated when gluten was introduced into their diet and what effect it had. So for those children who had their first gluten cereal from 0 to 4 months of age, they actually had a 5-fold increase in celiac disease as compared to those who introduction was after 4 months of age. Similarly, because we know that celiac and gluten sensitivity is highly associated with autoimmune disease, diabetes being one of those autoimmune diseases, there was another study that evaluated that children that were introduced to gluten between 0 and 3 months of age had a 6-fold increase in diabetes. So the answer is definitely yes. You want to hold off at least until 4 months. Personally, with celiac in the family, I would have recommended holding off a lot longer than that, but certainly the research shows that a minimum of after 4 months is a very good idea. There are some great tests for genetic profiling to see if a child is carrying the gene for celiac and gluten sensitivity, and it's so simple of a test. It's a swab on the inside of their mouth, so they just swab the inside, and that's all they need to run the genetic test. So certainly easy, non-invasive, and what a wonderful thing to find out, so that if the child is truly at risk, you're not putting them at risk for some very serious diseases and health problems. So I hope this helps, and until next time, I wish you very good health.